Hello, everyone. Today I'll be presenting my evidence based practice project on mindfulness based interventions for adults with general anxiety disorder or GAD. For this project, I reviewed current evidence on whether structured mindfulness interventions can be beneficial for adults experiencing moderate to severe symptoms of GAD. Throughout the presentation, I'll discuss why this topic is clinically significant, the process I use to search for evidence, the findings from the strongest studies, and my recommendations for how this evidence could be incorporated into practice. General anxiety disorder is a chronic mental health condition characterized by persistent and difficult to control worry. Its effects go beyond feelings of anxious. GAD can interfere with sleep, relationships, work, emotional well being, and overall daily functioning. Treatment may include medications and psychotherapy, but there's also growing interest in evidence based non pharmacologic interventions. Mindfulness based interventions teach patients to intentionally focus on present experiences with greater awareness and less automatic judgment. For this project, I wanted to examine whether adding a structured mindfulness approach could provide meaningful benefits for adults experiencing moderate to severe GAD. The significance of this problem is supported by recent U.S. data. Ferries and colleagues found that the projected annual prevalence of diagnosed GAD increased from 5.4% in 2020 to 6.6% in 2023. They also reported a projected 3 year prevalence of 10.3% from 2021 through 2023. These numbers are important because GAD is also associated with functional impairment, core morbidities, sleep problems, and reduced quality of life. This is relevant to nursing because anxiety is encountered in psychiatric care, primary care, emergency departments, and many other settings. Nurses may be involved in recognizing worsening anxiety, assessing symptoms, reinforcing coping strategies, educating patients, and monitoring their response to treatment. Based on this clinical problem, I developed a PICO question shown here. The population is adults diagnosed with general anxiety disorder who report moderate to severe anxiety symptoms. The intervention is a structured mindfulness based approach, specifically interventions such as mindfulness based stress reduction or MBSR and mindfulness based cognitive therapy or MBCT. The comparison is usual treatment alone, and the outcomes are reduced patient reported anxiety symptoms and improved coping skills. So, my overall question is whether adding these structured mindfulness interventions can provide meaningful improvements in anxiety and coping for adults with GAD, compared with their usual treatments alone. This PICO question also helped guide my literature search and determine which studies were the most relevant to include in my final evidence synthesis. To locate the evidence, I search PubMed for peer reviewed research examining mindfulness based interventions in adults with general anxiety disorder. My search terms include generalized anxiety disorder, GAD, mindfulness based interventions, MBSR, MBCT, anxiety symptoms, and coping. I combine these terms using the Boolean operators and or. I focus on primary studies that include adults with GAD or clinically significant anxiety, evaluated a structured mindfulness intervention, measured anxiety or coping related outcomes, and used a randomized research design. I initial The initial search resulted in five primary studies that were then evaluated based on their relevance to my PICO question. Five primary research studies were initially reviewed. From those five, I selected Jiang, Wang, Zhang, from the final evidence synthesis. These studies were selected because they most closely match my PICO question. Specifically, they examined adults with GAD and evaluated structured mindfulness, interventions using clinical relevant anxiety and coping related outcomes. Hogue and Speinhoven were also strong randomized studies, but their populations included multiple anxiety disorders rather than GAD alone, so they were less specific to my question. After clinical appraisal, all three selected studies were rated level 2A, meaning they provided high quality evidence. This table summarizes the three studies that provided the strongest evidence. Zhang and colleagues studied 106 adults and compared an 8-week mindfulness intervention plus medication with psychoeducation plus medication. The mindfulness group had significantly greater reductions in anxiety with post treatment HAMA scores of 18.6 compared with 22.5 in the control group. Wang and colleagues studied 140 adults using a self guided internet based mindfulness program in addition to treatment as usual. Participants experienced greater reduction in anxiety and depression, along with improvements in stress, rumination, mindfulness, and other outcomes. Finally, Jiang and colleagues compared MBCT with CBT in 138 adults. MBCT was found to be non inferior to CBT, with response rates of 86.2% for MBCT compared with 80.4% for CBT. Although the interventions were delivered differently, all three studies supported mindfulness as a potentially effective option for adults with GAD. When the three studies are considered together, the strongest and most consistent finding is a reduction in anxiety symptoms. The benefit were also not limited to anxiety scores. Depending on the study, participants showed improvements in mindfulness, perceived stress, rumination, negative thinking, sleep, and psychosocial functioning. These outcomes are important because they related directly to a patient's ability to cope with anxiety in daily life. The overall evidence was strong because all three studies were randomized, controlled trials, and used validated measures, assess- blinded outcome assessments, and appropriate statistical methods. However, there are limitations. Follow up periods were relatively short, and all three selected studies were conducted in China. Because of that, we have stronger evidence for short term improvement than we do for long term effectiveness or generalizability to more diverse populations. Based on the evidence, my primary practice recommendation is to offer an 8-week structured mindfulness program as an adjunctive treatment option for appropriate adults with moderate to severe GAD. I want to emphasize the word adjunctive. The evidence does not suggest automatically replacing medications, CBT, or other established treatments with mindfulness. Instead, mindfulness should be provided an additional evidence-based option. Patients should be assessed for their symptoms, current coping strategies, preferences, and willingness to participate. Organizations could also consider more than one delivery format. A group-based program provides structure and clinician guidance, while a digital program may improve access for patients who have difficulty attending in person. Nurses can play an important role by providing education, reinforcing participation, identifying barriers, and monitoring patients' response to interventions. To translate the evidence into practice, I would recommend beginning with an 8-week pilot program in an outpatient behavioral health setting. The first step would be forming an interdisciplinary team and educating staff about the purpose of mindfulness, eligibility criteria, referral procedures, and documentation. Adults with diagnosed GAD and ongoing moderate to severe symptoms could then be screened for participation. Depending on organizational resources and patient preferences, the program could use either a structured group format, or an approval digital mindfulness program. Patients would continue Patients would continue their usual treatment during the pilot. Outcomes should be measured at baseline. After 8 weeks, and again around 3 months later, this would allow the organization to evaluate anxiety symptoms, coping related outcomes, completion rates, satisfaction, and whether improvements are maintained over time. In conclusion, generalized anxiety disorder can significantly affect emotional health, coping, sleep, and daily functioning. Across the three high quality randomized controlled trials, structured mindfulness interventions consistently reduced anxiety symptoms. Improvements were found using group based digital and MBCT approaches, which suggests that the benefit is not limited to one delivery format. Based on the available evidence, my PICO question can be answered positively. Structured mindfulness interventions can reduce anxiety symptoms and may improve coping related outcomes in adults with GAD. The evidence currently supports mindfulness as an adjunct to established treatment rather than a replacement. An 8 week pilot with standardized screening and outcome monitoring would be a practical way to introduce this evidence into clinical practice while continuing to evaluate long term outcomes.